about how good heart health starts before you're born, you've come to the right place. I'm Dr. Kamek, co-founder of My Pedia Heart Care Partner. We partner with families to provide accessible, evidence-based pediatric cardiology care from the fetal life through adolescent years. Right now, we are reading a handout that you can download from our website, www.mypediaheartcarepartner.com. It is all about some of the most important risk factors that you can help your doctor manage for you while you are pregnant. These are risk factors that can affect your unborn baby. So let's get into it a little bit more. So some of the most important risk factors that we're going to talk about, first we'll talk about diabetes. So diabetes presents before pregnancy. The type we're talking about is type 1, type 2, that before pregnancy. These types are strongly linked with a higher risk of congenital heart defects, especially when the blood sugar is not well controlled early in pregnancy. So why blood sugar control matters? High blood sugar in early pregnancy can affect the organ development, including the baby's heart. That's why preconception planning and early prenatal care are so important. Let's look a little bit at these statistics. There was a large 2024 systematic review. This review, they looked at multiple studies and combined them into this big meta-analysis to look at prenatal risk factors for congenital heart disease. We're talking about congenital heart defects, maternal chronic diseases that led to congenital heart disease. Okay, so let's look at this a little bit closer. The study found that diabetes is associated with a higher risk of congenital heart disease in the baby. This is one of the most profound risk factors that a woman can have. The risk in infants of diabetic mothers was 3.5 to 5-fold higher than if you did not have a congenital heart defect. So just to put it in context, heart defects occur in about 1% of live births. But in a mother who has an unborn baby, mom with poor control of her diabetes, there is a 3.5 to 5-fold increased risk of congenital heart defect. And if the hemoglobin A1C was extremely high, at 10 or more, there was a 20 to 25% risk of birth defects. This is staggering. But it does also support what we see in clinical practice. We see that the risk is much higher when the diabetes is poorly controlled, especially around the time of conception, early in pregnancy. But the good news is there are things you can do. And this is all about risk reduction. So what you can do, 1, talk to your OB doctor, endocrinologist early, before you are pregnant, preferably. You want to know and ask them what your hemoglobin A1C goal is before you are pregnant and during the first trimester, and then work really hard to achieve that goal. Use medications and adjust them as you are directed. So whether a fetal echocardiogram is recommended, that is up to your doctor, but ask them, is it recommended for me? So let's move on to phenylketonuria. So phenylketonuria is a condition where the body has trouble breaking down an essential amino acid called phenylalanine. If a mother has PKU, short for phenylketonuria, the phenylalanine levels are high during pregnancy. If you have your levels greater than 15 milligrams per deciliter, it can increase the risk of serious fetal problems, including those affecting the heart. 12% risk of fetal heart defects if your phenylalanine level is more than 15. But again, there are things you can do to help. Work closely with your metabolic genetics team and your obstetrician. Follow the recommendations, diet plan strictly. Monitor those levels as directed, especially before pregnancy and early in pregnancy. This is that critical time window when the heart is developing and it is very sensitive to these high phenylalanine levels. Now here's another one we're going to talk about briefly that people really don't think about much, but it is a real problem. Severe familial hypercholesterolemia is a major problem in America. And we now know that when there is the most severe form of familial hypercholesterolemia, when you have genes from both parents and you have very high LDL cholesterol levels, that the fetus actually is at risk. Research now suggests that when the maternal cholesterol is very elevated, cholesterol can begin to deposit in the fetal blood vessels. And in other words, the early steps for plaque formation may start before birth. So this is very important. That matters because plaque buildup is part of what can lead to the premature coronary artery disease and cardiovascular disease later in life. And we're not talking about later as in 60s and 70s. We're talking about later as in 20s and 30s in this particular population. But again, there are things you can do to help while you're pregnant or before you're pregnant and during pregnancy planning. If you know that you have familial hypercholesterolemia or your cholesterol is very high, tell your OB doctor early. Ask if you need to see a cardiologist or a lipid specialist during pregnancy. Ask about safe pregnancy management and plan for postpartum treatment. Make sure your child's pediatrician knows the family history so cholesterol screening can happen at the right time and early. So I hope I hope that information helps you. We've covered just a few of the items that I really want you to start thinking about that can affect your baby's heart health. And just a few more things to think about. Most importantly, when should you ask about a fetal echo? A fetal echocardiogram is a specialized ultrasound that looks closely at your baby's heart during pregnancy. It is often done around 18 to 22 weeks, and it may be recommended when risk factors are present. Some of those we've talked about today, including pre-existing diabetes, phenylketonuria, a family history of congenital heart disease, abnormal findings on a routine ultrasound, and certain genetic tests when those are positive in you or your baby. So if your OB suggests the test, it's usually important to get it done soon, not to wait, but don't be scared. Your pregnancy heart health checklist is simple. Now, this is a nice little list you can keep and think about whenever you go see a new obstetrician. And here are the questions you want to know. Do I have a medical condition that raises the risk of heart defects in my unborn baby? Is my diabetes, cholesterol, PKU, or other problems? Do I need to make a special plan to optimize for my pregnancy? Do I need a fetal ecocardiogram? And if yes, when? And if a heart defect is found, what would this change about my delivery or my newborn care? Your obstetrician can help with some of those questions, and if you happen to have a pediatrician already, they can help you with the other questions. One thing that I do recommend that is not listed here is get support, but the support is from both a initial planning phase during the pregnancy and also after the pregnancy. Some families find it very useful to see a pediatrician before the baby is born and do what's called a meet and greet and learn all about the services they provide in their practice to see if it's a good fit. So if you have a baby with a congenital heart defect, I highly recommend you do that. Now, before we go, a few reassuring steps. Just know this: most babies are born with healthy hearts, and even when the risk factor is present, early care can make a big difference. If during your pregnancy you have diabetes, PKU, familial hypercholesterolemia, or any other medical problems that put you at risk, do not worry. Make a good plan with your primary care doctors, your obstetrician, and follow through. Your immediate next steps are: if you have questions about fetal heart health, risk factors, or whether fetal echocardiogram is right for your child, reach out to us, one of our care team members, and we will talk to you. And if your baby has already been diagnosed with a cardiac problem, and our fetal second opinion program can review those records, perform necessary testing if needed, and give you clear evidence-based options for the best next steps to give you clear direction. Book these appointments 24 hours a day online. That is both a first opinion and a second opinion at www.mypediaheartcarepartner.com. I hope this information was helpful for you. And again, if you want to download it, please go to www.mypediaheartcarepartner.com. You can select Fetal Heart Program and then select Good Heart Health Starts Before Birth and download the document we are reading today. All right. Bye for now.